Today. Thank you for coming to Senator Hannon's ABCs of OTCs. But I want to introduce our speaker, presenter, Carmela Avina Woods. She is with St. John's University College of Pharmacy, and she is an associate clinical professor there. So let's welcome her, and you're in for a lot of information this morning.
Thank you. Good morning. Good morning. I'm glad to be here today. So we're a smaller group, so if you can't hear me, or if I'm talking too fast, or I say something that you need more information on, just feel free to stop me. It's somewhat informal, and I like to get to know everybody also, so that's fine. So like Gail said, I am a professor at St. John's, but I always consider when people ask me, what do you do? I'm always torn between saying I'm a professor and I'm a pharmacist, because I'm both. So I work out of a pharmacy in Garden City at Walgreens. So I'm in the community. I've been in the community since freshman year of college. So it's a place that I like to call home. The reason why we set this up is because having worked in the community for so long, I see how important it is that people take so much medications. How many here currently take medications? Right? How many people, if I had to ask you also, would prefer not to take medications? Probably the same show of hands, right? But every medication is prescribed for a specific reason. It's supposed to help us live a better life, stay healthier, and make us more comfortable in the environment that we live in. But unfortunately, even when taken exactly the right way, can have some negative effects, right? So there's things like side effects and drug interactions, which we'll talk about. So a lot of people are a little reluctant to start medications because they feel like, well, I'm going to be doomed to be on this the rest of my life, and I've heard some horrible stories, and those commercials start out really well until that narrative starts and they start talking about all the potential side effects of a medication, and then you don't want to take anything. So a lot of people go out and would prefer taking something without a prescription instead. So they'll go into the pharmacy aisles and they'll see a commercial for something, or maybe talk to a friend who's on something that doesn't need a prescription, and they feel that that's a safer route to go versus going on those prescription medications. While a lot of the things over the counter, in order for them to be over the counter, they have to prove to be safer than prescription medications, but safer in the sense of safer for a patient to use without the supervision or the direct recommendation of a healthcare provider, right? So it doesn't necessarily mean it's the safest or safer, but it's safe enough for someone to use without a medical degree, okay? So there's certain things that are required for that medication to be over the counter, and that you can go ahead and purchase it without getting a prescription order from your physician or your other healthcare provider. But with that, we have to understand it doesn't mean that it's completely safe. There's potential dangers to them as well. So first, what do we think of when I say over the counter, or OTC? What does that stand for? What does anyone think of? What's an example of something's over the counter? Tylenol, Aleve, maybe Centrum Silver, right? Or vitamin C. These are all things that you could purchase without a prescription. But even though they all don't require a prescription, there are different buckets that they fall into. So something like Tylenol and Aleve is what a true classification of an over-the-counter product, an OTC. Because the federal government does have certain regulations and standards that those products have to meet in order for it to be available to a patient over the counter. Things like the vitamin C, the herbal supplements, are also available without a prescription, but they don't go through the same scrutiny as a true OTC product, such as your Tylenol and Motrin. So it does still have to be proven to be safe. Doesn't always have to prove that it's as effective as the other products do, right? So when we think about, let's start thinking about first that first product, that OTC product, that Tylenol, that Aleve, that Motrin. They've been in the news quite frequently lately about safety of their use. How do you decide which OTC product to use? If you're going to have, let's say you have an aching knee, or you wake up in the morning and your back hurts, and you're going to go to that shelf to pick up that pain reliever. How do you decide what to use? What makes you decide? There's a lot of different reasons that I've heard, but anyone want to share what you decide? Is it?
Well, you know what? If you have a pain in the knee or the elbow, whatever it is, and you go into one of the pharmacies, and you go down the aisle and the aisle and the aisle, what am I looking for? What do I have? What we don't have today is what I had when I was a kid years ago. You went to the pharmacist, and he was like a half a doctor. And he'd say, well, gee, I got a pain here. He would recommend something, or he would mix up something.
I'm very glad you brought that up.
We don't have that today.
You know what
We
it
don't
is?
have it.
You do have it, but you
Well,
have to look
very,
for it.
Very limited. The
Yeah.
Franklin Square Pharmacy is about the only pharmacy that I would probably recommend if I had something minor.
Okay.
You know, if it was something major, you go to a doctor. 9 times out of 10, I would go to the doctor because I'm Medicaid covered for it.
Right.
So when I go back to look at all the prescriptions and over-the-counters, and I
It's
never wanna look
overwhelming.
at it, except when I'm
Absolutely.
reading.
Absolutely. So made a
So-
very good point. It's overwhelming. When you go into the aisles, and I can't tell you how many times I go into the aisles and it's so colorful and there's so many different products out there, it is overwhelming. So sometimes we might go and pick a product out that your friend had told you about, or you saw on TV like we said before, or if you're on the computer, you've seen or looked up yourself on the computer, or you've seen a lot of these medical shows now on TV. Which are helpful information, but we have to make sure that we understand that a lot of those medical shows, for example, those physicians on those shows know a lot of things, but what's the one thing that physician does not know? You, absolutely. They don't know what medications you're taking. They don't know what disease states you have, because those products that are out there, if you read some of the labeling and the packaging, I think I want to take all of them, because it'll make you thinner, your hair longer, your skin beautiful, give you energy, and make you a lot smarter, right? But it's going to promote certain things, but it can't always say that it's proven to be safe and effective to you. So we have to be careful with that. So the gentleman brought up a really good point. Is the pharmacist is still there. So today with me I have Christian Stella, who's a pharmacy student. He's going to be graduating this year. Pharmacists go through 6 years of pharmacy school. And in those 6 years, they spend about 9 months or so on clinical rotations out in pharmacies in different areas, whether it be hospital, Walgreens, and Rite Aids, and so forth, where they get that experience to help you make those decisions. After graduation, they take 3 board exams in New York State to pass, and many of them continue on for residencies and so forth. So your pharmacist is one of those key persons that you can go to help select that product that's over the counter. We have the knowledge and the skills to evaluate the information there. But even before going to there, or maybe you're in a location where there isn't a pharmacist present, or the pharmacy department is closed. And remember, OTC means you can purchase it without a healthcare professional. Some of the information that's on the table back there, it's called the drug facts label. So anything that's deemed a true over-the-counter product will have a standardized label on it. It's called a drug facts label. And on there, and it's usually the back of the package, so I always joke with the students when we go into the aisle and I say, what product are you going to use? And they pick it up and they look at it and I say, well, you got to turn it around. So the pretty picture in the front that's really colorful, that has shiny words on it and fancy writing, that's not what you want to look at. It might catch your eye, but you want to turn that bottle around, turn that package around, and look at the drug facts label. There's very important information in there, and it's set up the same way for all over-the-counter products. So even something like Colgate toothpaste or Crest toothpaste, any of the toothpaste, will have a drug facts label on it because they have active ingredients in that will cause some type of reaction when put into your body. So drug facts label is something really important. The thing we have to be careful of, sometimes they're tricky. Sometimes the print is really small and hard to see. So some pharmacies and pharmacists do have magnifying glasses there that you can use, or you can purchase one on your own and carry it with you. Some of them are tricky because you have to peel back the label in order to expose the complete drug facts label, which is, even for me, sometimes hard to grab that little lip and pull it back. We had a patient come to our pharmacy. She says, you know, I can't for the life of me figure out how to use this. And she's had it in her house for a week. She was actually having some severe stomach issues, and she was suffering for a week, and she hadn't used the product. And I asked her why. She says, well, I can't figure out what the directions are. She never even knew that she had to pull back that label. And once we did, she's like, well, this is great, but I can't see what it says there. So we helped her kind of read it. So what's on the drug facts label? The very first thing that's listed there is the active ingredients. What is that? That's whatever is in that product that's going to elicit a reaction in your body. So that's the most important thing. And if you look at some of them, I know when I sometimes have someone call me and say, I have this product and I don't know how to use it, and I ask them, well, what's in it? Well, and they give me the brand name. Like, well, turn the bottle around and let me know what it is. And it's like 18 letters in the word, and there's no way they're going to pronounce it to me. And I said, you know what? Look to the right of it. It tells you the purpose. So you don't have to really be a scientist to figure out it says acetaminophen. You could just look at the purpose, which says pain reliever or fever reducer, and that will help you. So it's in terms that someone can understand who doesn't have a medical background per se. It also tells you the specific directions on how to use it. It gives you warnings and precautions about that drug. So if there's any special conditions that you have, it will be on that label. And if it's not on the label but you're not sure, that's when you definitely want to bring it up to the pharmacy or the pharmacy intern. So Christian's a pharmacy intern. So after the third year of pharmacy school, I've also heard, well, go up to the pharmacy, but they look so busy back there. I feel bad bothering them. But that's what we're there for. And that's what interns are there for. So they can practice under the direct supervision of a pharmacist. So you can present it to the counter, and they will translate or bring that information over to the pharmacist, who will walk over themselves, or the pharmacy intern can help you as well to help make sure that product is safe and appropriate for you. Drug interactions, what is drug interactions? We hear that all the time. What does it mean?
It's when one drug doesn't work so well with another or causes something else to happen because you take the 2 or 3 drugs together.
Great. So it's when one thing is presented with another thing, and kind of think of two people that just don't get along, like oil and water, and it can affect the other. It may make one of those two products not work at all. It might make it work super stronger than it would normally. Or it may actually deactivate both of them, or there's other things that we have to consider. So it's not always drug interactions. A lot of products, even over-the-counter products, can be affected by the foods that we eat, the things that we drink, or the disease states that we have. So if you're a diabetic, let's say, or if you're someone who has high blood pressure, there might not be any direct drug interaction between the product over the counter and what you're going to take, or what you've been taking, but it may affect your blood pressure in a way. Right? So now we're still in the cough and cold season. There's a lot of medications out there for cough and cold that can be very overwhelming. So we're talking about curing everything. So you go pick up a product and it's coughing, sneezing, headache, congestion, and it's like, well, this has got to be a great product because it covers everything. You don't want to take more than you need to, right? So when a pharmacist, or a lot of times I recommend to a patient, well, you should take box 1, 2, 3, and 4. Like, well, you just want me to spend more money and get 4 different things. I don't. I'm doing that on purpose because you might not need all of those ingredients in those combination products. And in those combination products, there's a lot of hidden things sometimes. Now, how many of you, and there used to be a commercial, and sometimes I show my age with the students, of certain products that, plop, plop, fizz, fizz, what a relief it is, right? So, and if you look at the Alka-Seltzer bottles, and just using that as an example, it could be anything. Have you ever read the package on there? It relieves everything. Headache, indigestion, pain. Sounds like a miracle thing, but you don't realize there's actually aspirin in some of those products. So if you're someone who's on a blood thinner, or someone who has severe stomach issues, or bleeding or blood issues, you don't want to take that product. And it's hard to realize what those ingredients are unless you're looking at that package in the back. And you don't know everything. So sometimes it's good to have that second of eyes of someone who has the experience and the knowledge to make sure that those ingredients in there will not harm you and will actually help you. So taking those products separated, buying multiple ones, there's pluses and minuses to them, but you only want to take what's necessary or what you need. Taking more of that can actually cause more harm. So something as basic as a cold, those multi-stimulant products might actually dry you out more and make you feel worse. So you don't want to take things that you don't necessarily need. So that's another reason to make sure you look at that drug facts label in the back, not so much just the advertising that's in the front. It'll give you information about storage. It'll also give you some information about the inactive ingredients, which are really the things that don't elicit so much of a reaction. But if you're someone who has allergies or is sensitive to certain things like dyes and so forth, that would be in that inactive ingredient section there. So things like Tylenol, Motrin, Advil will have the standardized label on it. When we think about vitamins and supplements, they don't have that standardized label on it. And that's where we have to be a little bit more cautious. How many take a multivitamin? Who takes a multivitamin? Okay, do you take it every day? So that's a question I get a lot, is should I be taking a multivitamin? Should I take extra vitamin C? Should I take extra vitamin D? Do I need a vitamin B and so forth? So when it comes to vitamins and supplements, again, they don't go through that standardization, that all the requirements that an true OTC product like your Advils, Motrins, Tylenol, and so forth would have. But they do have to be proven to be safety. They cannot make claims, right? So if anything that you see marketed, and going back to where do you get your information from, so you're sitting down one day and you see a commercial for this new herbal product that sounds like it's going to cure everything, if it's too good to be true, probably is. Right? So you have to be careful with certain things that make certain direct claims to cure anything. Most of the time it's legal and they can't claim to cure anything, but you have to be mindful of, do they have the evidence to support the statements that they're making? Is it biased, right? So if you are familiar or go onto the computer a lot and see some advertisements and so forth and want to find something out about a certain product and you put it into your search engine and it comes up there's a lot of advertising on there. If there's no dates of when it was recently updated or credible authors, take it with a grain of salt that this is a manufacturer that might be trying to sell you a product. So you have to be really mindful of that. And a lot of these products, which are considered supplements and vitamins, have not been fully tested with every disease state that's out there, with every condition. And in particular, as we get older, we have to be mindful of certain things. From the day that we're born, we start to age. Our body starts to change, right? So I see it, I have a 2-year-old and a 4-year-old, and I'm amazed at how much I rely on them to remember things sometimes. And my son's like, well, that's not my toothbrush, Mommy. I'm like, oh, sorry. But as we get older, yeah, our memory can go a little bit and we can forget things, but our body changes inside that we don't even see. Our kidneys change, they don't function as well. And I think of our kidneys as one of the biggest filters in our body to break down and take out medications and keep what's important and so forth. So our kidneys don't work as much. Our distribution between fat and muscle changes, right? So because of that, the absorption and how much drug we keep in our body and how much we get rid of changes. So because of those changes, we have to be extra cautious when we're picking up a product that's over the counter, because it does work differently in someone who's a little bit younger versus someone who's a little bit older. And that's something that even the drug facts label may not always highlight. So there's certain products, for example, over the counter, we talked about, some of the pain medications like Tylenol and Motrin, and the active ingredients in there are usually found in multiple products. There's some recent warnings out there about the use of what we call NSAIDs. So an NSAID is a non-steroidal anti-inflammatory, like your Motrin, your ibuprofen, and your Aleve, naproxen. So Motrin and Advil both have ibuprofen in it. Aleve has naproxen in it. Those are probably the most commonly, or the only ones out there that really falls into that category that most people use. There's some real warnings out there that came out in July. They were there before, but they're stronger now, that using these medications, even over a short period of time, can pose some dangers to patients who have a history or current conditions of cardiac conditions like high blood pressure or have had a heart attack in the past. But it also can be dangerous in those who have never had a heart attack in the past. So now you're thinking, well, what am I going to use if I have pain? So maybe I'll go to Tylenol. Tylenol has some warnings as well, right? So if you're someone who enjoys alcoholic beverages throughout the day, or someone who has liver or kidney problems, someone who's on a blood thinner, long-term use and a lot of use of Tylenol has some warnings with it as well. So there's some limitations of how much we can use when it comes to any product. So my general rule for any product, in particular when we talk about those NSAIDs and things like Tylenol is, and even prescriptions, is you want to use the smallest amount that you need for the shortest period of time, right? So I oftentimes have people come to the counter and we've decided on which product to use for them based on what they've told me and the questions that I've asked, and there's 3 different strengths. They always want to go for the strongest one. Well, give me the strongest one, this way I'll take care of it and I'll be done. You don't want to go with the big guns first, right? So I give the example to my students that if you have a fly on the wall, I could take a cannon and shoot it at the fly. Will the fly die? Yeah, right? Probably if I shoot it the right way, if I have good target practice. But what's going to happen to that whole wall? It's going to destroy the whole wall. But if I get a fly swatter, it'll be specific to that one fly, and I'll get rid of that fly, and I won't damage anything else. So you don't want to go with the big guns. You want to make sure that you leave some room for an increase in dose if needed. You may not need that strongest medication. And when things start to improve, we may not always need to take that medication, right? So we see some recent news now about the stomach medications, we call them PPIs, your Prevacid, your Prilosec, I'm trying to blank of the brand names out there, omeprazole and so forth that's available over the counter. And that's recently been in the news that now there's an association between dementia and some of those. But remember, association is a word that's not, we have a lot more research to do on that topic. So if you're on certain medications and you hear something in the news, you get a little bit startled sometimes and say, whoa, I don't want that to happen to me, or I have a family history of this, I don't need more risk to it. Speak to a pharmacist, because it's not true for every population. And just like anything, it's always risk versus benefit. So someone who has a bleeding ulcer, there's more risk of not taking that medication than any association with possible dementia. But at the same time, it's a good opportunity to reevaluate, do I really need these medications right now? When we go to physician's office, even with prescriptions, if it's something, oh, I've been on that for years, and you're talking to your pharmacist or a friend or a new physician, and you kind of disregard certain things, oh, I take that all the time. Don't disregard it, because what's happened over that time? One thing that's happened over the 5 years that you've been on that medication, we're 5 years older. So things may not be necessary anymore. So whenever you're selecting anything over the counter, ask yourself, do I really need this? How much of it am I really going to take? What's going to happen when I take it? And how am I going to fit this into some of the things that I already have? And a pharmacist can definitely help you answer those questions. When we think about sleep agents over the counter, and I use my grandfather all the time as an example. He was a farmer his whole life. From the minute he could walk, he was put on the farm. And he worked all day long, and they weren't very, rich, so they ate whatever they could get from the farm, and they were very limited. And he came to America, lived the American dream, came here. And now he says, well, he's retired. I have I can eat whatever, and I could sleep as long as I want. And he goes, you know what? Now I retired. I can't sleep. When I wanted to sleep, I couldn't sleep because I had to work. Now that I have the time to sleep, I can't sleep. I just can't fall asleep at night. And now that I have all these foods, the doctor keeps telling me, I can't eat this, and you got to watch out for that, and you got to watch out for that, and he has all these limitations put on him. We have to be mindful, though, that though our needs change and our bodies change, not everything out there is an easy fix. So the sleep agents that are out there that you say, well, you know what, maybe I need to rest a little bit, let me go ahead and take this PM product that's out here, or this night product that's out here. There's definitely some warnings and precautions to using those medications that can cause harm. They can actually do a lot of different things. Not only increase your risk for falls, which is a very important thing that we have to be mindful of as we get older. Things that we've been doing our whole lives that now all of a sudden can become a risk. Anything from a daily activity to a product that we've taken over the counter before, like a cough and cold medication. Or even something that has a common name like Advil or Tylenol and it has a PM put to it. That ingredient in it that makes it PM can increase your risk for falls greatly. It can also affect the disease states you have. If you have glaucoma, if you have prostate issues, and a lot of other conditions that we have to be mindful of. Remember, as we get older, our body tends to hold on to certain things a little bit longer in certain situations, which can make that medication that was fine for you 5 years ago very dangerous for you today. So we have to be mindful and ask questions to our pharmacists and make sure our pharmacists know what we're taking and what we're being treated for. Now, how many of you right now, if I asked you what medications you're taking, could tell me the name, the strength, and how much and what it's for? Okay, good, good. How many of you have right now a written document that lists all the medications that you're taking? So that's pretty important. I'm glad, I commend you for having that with you. Because when you go to that pharmacy, especially if you're not feeling well, and you have that head cold, and that was me yesterday morning, I woke up, I felt like my head was like 3 times its size, and I couldn't breathe, and you go to the pharmacy, you go to the aisle, you're overwhelmed, you're not feeling well, it's hard for you to remember all those medications that you're on, right? Or even worst case scenario, outside of talking about the OTC stuff, you're in your house and you do have a fall. And now someone comes to help you, whether it be 911 or a neighbor or so forth, and let's say you do have to go to the emergency room. It's important for those healthcare providers to know what medications you're on, right? To know what you take. And it's hard if you've just fallen or you're kind of shooken up to remember what all those things are. And I've had seniors tell me, and spouses tell me, well, if I fall, I'm always with my husband will let them know. If you have a fall, your husband might be shaken up. And he's so worried about you, he might not remember all those things that he needs to know. Just like when you go to the pharmacy, oh yeah, I have it, at home I have all my medications. One way to solve that is to carry a medication card with you. Medication card is very simple. It has your information on it, basic as your name and date of birth. You can have a contact information as well as a phone number. But it lists all the medications you currently take. The name of the drug, the strength, the directions. You may want to put the name of your physician on there and the allergies that you have, or any vaccinations you received recently. And keep that with you. Keep it in your wallet, keep it in your bag. And one thing that we're going to do next week, if you can come next week to the brown bag, and I'll describe what the brown bag is towards the end, we're going to sit with you and help you create this card. We're going to manually write it out for you. It's a piece of paper. You can do it on a notebook on yourself, but we can help you do it. And what you're going to do is going to carry that with you all the time. You're also going to keep a copy of it at home. Keep it on your refrigerator. So that this way, in the event something does happen, everyone knows what you're on, right? So I always joke around, how many people have an endocrinologist, a doctor for, you don't have to raise your hands, but most people have a doctor for their diabetes, which is an endocrinologist, a doctor for their lungs, a pulmonologist, a doctor for their feet, a doctor for their heart, the cardiologist. So I joke and say, how many ologists do you have, right? Because what is the cardiologist going to do? Don't worry about your heart. What does your pulmonologist do? They worry about your lungs and your COPD or your asthma or so forth. And some doctors are really great at trying to look at the overall picture, but their main concern is making sure your heart keeps working properly. So he's prescribing something, someone else is prescribing something, or you have one thing filled at a different pharmacy because it's closer to the doctor's office. There's another one filled at your local pharmacy when you're home, and when you're at your daughter's house, you go somewhere else. It makes it hard to keep track of all the medications you have. So when you go to buy that over-the-counter product, even if you go to the pharmacy, if that's not the pharmacy you fill all your prescriptions on or at, they're not really going to be able to check everything to make sure it's safe for you to use that product unless you have that medication card to help them, right? To help them make sure that the current medications you're on are not going to cause a problem with whatever product you want to take. So those medication cards are really important to have with you. We also see that a lot of insurance plans are encouraging patients to use mail order pharmacies. Right? Does anyone here use mail order? So when you have a mail order pharmacy, you still want to keep a good relationship with your local pharmacist. Why? Number one, if you go buy that OTC product and you come to our counter and we say, "Hi, Mrs. Smith, nice to see you today," and you ask about the product and we go into the computer system to look, we're not going to be able to see what you fill in other places. So there's no one universal system. The pharmacist is only going to see what we fill or what you tell us. The other thing is, you use mail order pharmacy, mostly it's for your maintenance medications, the things you use on a regular basis. But if you ever have a cold or an infection or a pain and you have to go to the local pharmacy, have a relationship with that pharmacist when you're feeling well. So on days that it's sunny, it's nice, and you feel well, walk into a local pharmacy, present your insurance card and say, "Hi, I'm Carmela. I just want to set up a profile here with you." Give them their insurance information. Let them put your name and your address and your allergies and your medical conditions in there so that in the event that you don't feel well, you're not grilled with a million questions and you can have your prescriptions taken care of because the profile is set up already. They know who you are, and that's taken care of on a day that you're feeling clear and feeling well rather than waiting when you're sick. And tell them the other medications that you're taking. So that this way, again, you have that relationship so that if you have the need for an over-the-counter product or a short treatment of something, we can make sure that medication is safe for you in that one time that you're filling it. The amount of products that are out there, every month when I have students, we go walk through the aisles. I'm amazed at how many new products come out continually and get changed, and there's warnings and precautions. So you want to make sure that when you are selecting those products, you go to your pharmacist and they help you understand if that one's the correct one for you. Talked about vitamins and supplements briefly. Okay, we mentioned it a little bit, and I oftentimes get the question, well, should I take a vitamin? Should I take a multivitamin or not? Vitamins and supplements, whether it be one of the multivitamins that has everything possible under the sun in it, or something specific like a vitamin D, let's say, they are beneficial, but mostly in patients who have a deficiency. What does that mean? That means you've seen your physician, they've done a blood test, or if you come with a sign or a symptom of having an ailment, and they see that your levels are low in that one particular area. So supplementing that area with a product would be beneficial. So someone had a blood test done, their vitamin D levels are extremely low. So now what we're going to do is we're going to supplement that by taking that over-the-counter product. Unless you have a true deficiency, my best answer is if you're eating a well-balanced diet, you don't need the extra supplements. The best way to get those vitamins and nutrients and minerals are through food. But let's say you have a certain condition where you can't take dairy products. You can't tolerate gluten because you have celiac disease, or you have other conditions or allergies that limit your diet. Then a vitamin or supplement would be appropriate because you're not getting it from your food or nutrients. If I was having an over-the-counter chat with seniors about 5 years ago, we would be really pushing calcium, a lot of calcium and vitamin D. And now we actually most of the literature shows that the best way to get this stuff is through your food, right? Through your food. The best way to get vitamin D is through sunlight. And believe it or not, sunlight will help you sleep better at night. So one of the things we was discussing with Christian earlier today is a lot of those sleep aids out there. And I gotta honestly say, I don't think there's any one product out there that I would say would be completely safe for someone who's a little bit older to take, and I can go to bed at night knowing that there'll be no problems. Everything has potential side effects or adverse events or drug interactions associated with them. But being outdoors is a wonderful thing, and that's why they say in the wintertime we kind of get the winter blues a little bit. Sunlight stimulates our body's own production of certain hormones that will help you sleep better at night. It will help you absorb that vitamin D. How many of you, I don't know if you've, I remember going to the beach and coming home, and I was single and so forth. I'd come home from the beach and I'd be so tired. My dad would be like, "You were at the beach all day. Why are you tired?" I went to work. But it's true. The sun makes you tired. The sunlight, the daylight stimulates certain body part hormones that make you feel sleepy later on in the day. So having that daylight, having that sunlight does help, and is probably better than any supplement that you would take. There's not a lot of drug interactions as long as you protect yourself from getting sunburned. And I think we've done a really good job of protecting us from that. That we've actually seen that vitamin D level go down because we protected ourselves from the sun maybe too much. So not prolonged. I'm not saying put baby oil on and go sit on the beach like maybe we did years ago, but you want to make sure you get that daylight, get that activity, get the social activity. It's probably better, it's proven to be better than most of the supplements, vitamins, and herbs that are out there. So that's really important to understand as well. So kind of touched on a lot of different things when it comes to over-the-counter and OTC products. I guess one of the most important things I want to make sure you get out of this, leaving here today, is one, learn and get accustomed to reading the packages appropriately, not just the advertisements, but the actual drug facts labels that's behind there. Making sure you have a comprehensive list that's updated on all your current medications, right? And that includes eye drops, lotions, those are medications as well. Over-the-counter products that you take on a regular basis, or even as needed, should be on that medication card. Share that information with your pharmacist. We can double check it. And I'll be the first pharmacist to say that if you walk into a pharmacy and you feel like you can't talk to them and you can't find them, I'll be the first one to tell you, find another pharmacy. Find a place that you're comfortable with, that you can have a conversation with, that it can help you understand not only the importance of prescriptions, but over-the-counters. Most pharmacies now provide immunizations, which is so important. Most of them you don't need a prescription for. We'll take care of it for you. Keep yourself up to date. And we can help answer a lot of questions beyond just your prescriptions, or, we take care of cost and billing and so forth, but there's a lot of other important information that a pharmacist can provide to you. So just keep that in mind as well when you're going out there and looking for a product or selecting a product, or even where you're purchasing a product. Make sure the person you're speaking to, look at their name tag. Find out who they are. If they're a pharmacy intern or pharmacist, some great technicians out there that can direct you to the right people to help answer your questions. Is there any specific questions you have about either selecting an over-the-counter product or?
I just wanted, when you were talking about the interaction, do you talk to them at all about an interaction with alcohol?
Yes, so in terms of OTC, over-the-counter products and alcohol, right, so we briefly mentioned that, with Tylenol now and products containing Tylenol in them, there are new warnings on there that if you do drink or consume alcoholic beverages, being very cautious on taking Tylenol and how much Tylenol you're taking, because it can cause significant liver problems. Alcohol comes into play with medications that can, and by medications I mean over-the-counter or prescription, and including that supplements and herbs, that can cause sedation. And that can add to that sedation, which increases fall risk, which we know that as we get older, tripping when we're 20 is one thing, but tripping when you're above 65 or 80 or so forth can completely change your world. So you have to be really mindful of that. So absolutely, alcohol is something to consider. And a lot of people, I think, unless they're specifically asked, don't necessarily volunteer certain information. And so the pharmacist, when you're asking them over-the-counter questions or about a product, they should be asking you some questions. So if you ask, well, why are you asking me so many questions? Just give me what I need and let me go. We're asking that because we're screening to make sure it's appropriate. So they may ask you, do you have an alcoholic beverage? Are you a smoker? There's certain eye health treatments out there for macular degeneration that if you're a smoker or a previous smoker, they've actually shown that it actually increases the risk of certain cancers. So selecting a product and getting that little bit of a history is important. So that's why, yes, absolutely, we do discuss that. We take that into consideration. And you're your best advocate. You're absolutely your best advocate, so you have to be the one to ask the questions. Don't be afraid to ask pharmacists questions, as well as your physicians. So nowadays, we're going to see this more and more at the end of March, that prescriptions are going to be electronically sent over to pharmacies now. So you won't be walking in with a piece of paper. They won't be giving you that piece of paper. So make sure you take that opportunity now that it's more convenient now. You might only have to go to the pharmacy once instead of drop off and then come back to pick up or wait for it. Take into account that, take advantage of that interaction you have with your pharmacist while you're there. Ask your physician their questions as well, but ask the pharmacist their questions, because this is what we do. This is what we specialize in. So it's important to take advantage of that. Great question.
What about generic and as opposed to brand?
Perfect. So we get that question a lot too. Which one should I do?
It's not the same.
Okay.
If it were the same, it wouldn't be so cheap.
So that's absolutely
What they bind it with, most people are allergic
So great. So the question was, what about brand and generic? So I'm going to give you a little bit of the definition first, right? So a brand name product, when a medication goes into market and they start researching it, it takes years and years of research for them to get it onto that shelf for a patient to use or a pharmacist to dispense. So that means research in the lab with animals, with humans, and a lot of legal things that they have to go through and requirements and standards. It takes several years, depending on the need for that product. It's going to take several years. What does that mean? That means it costs them a lot of money to get that to the product, to the shelf. Once they do finally get approved by the FDA to be on that market, they're going to put what's called a patent on there. So that patent is going to lock up that secret recipe so that no one else can manufacture or produce that product until that patent is out. And most patents are about 10 to 15 years. Some of them are a little bit less, some are a little bit longer, where no one else can manufacture that product. And that's an opportunity for that company, that manufacturer, to gain back some of the billions of dollars that they've spent to research that product and get it on the shelf. So that's why it's so expensive for the most part when we think about a brand name drug. Now when that patent runs out, other companies now are able to manufacture that drug, but they don't have to go through all of that research because it's been done already. So they don't have those billions of dollars to pay back. So that's why they could sell it for a lot less, because they don't have all of that debt that they have to go back and try and pay off. So that's a big reason for the difference between the brand name cost and the generic cost. Now for something to be deemed generic, it has to have the exact active ingredients, which we mentioned earlier, as the brand name in the same exact form, and has to be proven to elicit the same reaction in the body in order for it to be deemed generic. The thing that doesn't have to be exactly the same, which you alluded to a little bit, is the inactive ingredients. So in a small percentage of patients, if you're sensitive to certain inactive ingredients, yes, you might see a difference between the two. But in order for something to be deemed a generic, it has to be proven to be safe and as efficacious and do the same thing in the body as the brand name does. Now in New York State, a pharmacist is not legally allowed to switch between brand and generic, so sometimes it makes it feel like, oh, it's a bigger deal for me to switch to a brand or generic. It's just a legal requirement. In other states, pharmacists can switch between the two without even calling a physician. But that's the main reason for the difference excuse me, in the price between the brand and the generic. It's mostly because of the high cost that goes into and the years of research that goes into that particular product getting on the shelf versus a generic one. So I'm going to be honest with you, most of the time I recommend the generics because I see that cost is an issue for a lot of people. You know, you're on a budget or so forth, and unless I have a reason to believe switching from one to another would be harmful, and that's like a small selection of patients that, and even products that are really sensitive, I call it my sensitive drugs, that I wouldn't recommend switching. But it brings me to another good product of if you are if you are going to select an over-the-counter supplement or a vitamin, whether it be CoQ10, which a lot of people use if they're on certain cholesterol medications, let's say, right? Try and purchase a product that has a little emblem on it that says USP. So there's more standardization, and try and keep with the same brand so that this way it minimizes the differences in those products from one to another. And a lot of times when we go into pharmacies, they have these sales, buy one, get one free. So you get 360 and you can get another 360 for free. Be very mindful of that. Are you really going to use 720 tablets? And how long is it going to take you to consume 720 tablets? So it sounds like you're getting a deal and you almost feel like, well, I have to get it. It's 50% off. The second one, I have to purchase it. It's more bottles in your house, more chances of potential medication errors. Also pay attention to expiration dates. Expiration date on a product that's over the counter or anywhere actually means that we can prove this product is safe and its effectiveness up until this date. Past this date, we're not really sure because we haven't researched it. So be mindful of your expiration dates as well when you're buying these large quantity of products. And you know, a lot of these wholesale clubs and so forth sell these large quantity of products, especially when you're just starting out on something. Purchase a small quantity of it. You don't want it in your house, right? And disposing of these medications becomes an issue. You don't want them all going into your toilet and flushing them out. There are proper ways to dispose of medications. In Nassau County, I believe every police station, if you walk in there, has that bin right in the front, no questions asked, just dump everything. And there are certain limitations of the controlled substances and syringes and so forth. But then you don't have to worry about your personal information on those labels either. Your name, everything gets incinerated. So don't have to worry about it. That's the best way probably to dispose of medications. And I tell everyone with the change of seasons, you know how we say you change your battery on your smoke detectors? Go through your medication cabinets. Go look through them. If you haven't used something in the last couple of months, get rid of it. Because what's happened in those couple of months? Now you say, well, I'm going to hold on to it. This cost me $50. Maybe I'm going to have that rash again next year. But guess what? That rash next year might be caused by something completely different. And what's happened in that 1 year? You've gotten a year older. So that medication might not be safe for you anymore. So next week, one of our main goals is for you to actually, between now and next Thursday, I'm giving everyone a homework assignment. This is a teacher in me coming out. Go through your house. Pick up every bottle, every drop, every lotion, any medication, prescription or not, that you have in your home. Put it in a bag. It doesn't have to be a brown bag. Senator gave out some nice red bags today, so we call it a red bag day. Put it in that bag. Bring it in next week. Make an appointment with Gail to sit with a pharmacist one-on-one. I will be here next week, so will some other pharmacists as well. You'll be able to sit at a table dedicated to you to go through each one of those bottles. Why am I using it? How am I using it? What should I expect from it? So this is not to contradict anything a physician or another pharmacist says. We work as a team. A team, what are we rooting for? The one person we're rooting for is you, and you're at the center of that team. So come in next week with all those products. We'll go through each one with you. Hopefully try and answer every question that you have. If not, if we don't know the answer, we'll get an answer to you. So we really do encourage you going through those cabinets and also be in mind of where you store your medication. That's a big thing we'll talk about next week as well. So excellent question. I warn my students, I don't give one-word answers to anything. I go on forever. Does anyone else have any questions for us? I know I don't want to keep anyone longer than they need to be. Is there anything else that I can possibly help out with? Christian, anything else you want to add or anything I forgot? No? Medication cards, we'll give those out next week as well. So if you have one, you can bring it in. Like, we'd rather see the actual bottles if you can, but if you're not comfortable with bringing the actual bottles in, that's fine. You could bring in that medication list and we'll go through that with you. Write down questions. You know, we tell patients all the time to write down their questions before they go to their physician's office. One thing that we forget to tell them is that bring that paper and pen with you because you want to write down the answers. Because you'll get the answer there and then you get home, oh, I don't remember what he said. Write down the questions, but write down the answers as well. So question anything that you take before you leave your pharmacy, before you purchase the pharmacy. Open that bag up at the counter before you leave if it's a prescription. Make sure you know what you're getting before you leave. And make sure you know the phone number of your pharmacist as well, so that when you're home, you just got your tooth pulled, you're kind of in pain, you kind of hear words, but you're not really listening. Then you get home, you're like, oh, how do I take this? So make sure you have a good, comfortable person that you feel comfortable speaking to, and that could be your community pharmacist. So look forward to seeing everyone next week. And again, even if you have someone, a relative or a friend that's not here today, and they're welcome to come next week, we'll have, I think, plenty of some slots open up for people who decide a little bit later on whether or not they can come or not. And even if it's just a reinforcement of things that you know already, or establishing that relationship and seeing the value of a relationship with a pharmacist and all your healthcare workers, providers, is really important. So thank you very much.
Thank you, Cornell.